So today we are going to discuss about the myths and misconceptions regarding the sexuality. A lot of patients will come in the clinic with the notions and misconceptions regarding the psychosexual aspects. So first of all, we will discuss from where these misconceptions are originates. So there are certain factors such as the topic is less discussed among the youth and considered as vulgar and obscene. The aspect is considered extremely secretive and unacceptable. The information then comes from self-learning, from friends, those themselves are not aware of the facts. They have been misinformed by the immediate elder ones or other persons like friends, and they move to the quacks and they trapped in the information of myths. So how these myths are present in the society. So we will take the session in a question answer form. The first question is, do men want sex more often? So this is a misconception. So for your understanding, sexual desire varies from person to person, both men and women, but it is not always true that male always want more frequent sexual activity. So being member of the same species, both have the sexual desire, may vary slightly but have similar one. So another aspect is women involve more in the emotional aspects in the sexual context. That's why their sexuality uh, is not so much expressed and they may be considered as having less sexual desire. Openness also does not translate into being able to express their own desires, as we had discussed the upbringing of the females, how they are restricted and uh, not considered so much good if they are pro in their expressions. So they do not express their own feelings. That's why it may be portrayed as they have less sexual desire. So again, the thing is, they may consider not socially acceptable if they are expressing their sexuality, and this is viewed with the stigma from the both sides of the society, men's and also the women's are having viewed this expression as a stigma for their female part only. Everyone in the couple should be able to discuss their expectations to overcome this discomfort level, and uh, they may need to strengthen their communication regarding the frequency. So normally a man may feel normal having sex with any woman he meets, but a woman needs to develop emotional unity with him in order to accept. Once the unity is accepted, then this may lead to uh, more desirous for intercourse. So this is the subset of question within this aspect of frequency of more sexuality. The men think about sex every 7 seconds. But if you look for transformation of this data into actual data, it comes out to be nearly about 8,000 times a day, which is not very obvious or not very logical. In a study, which has been done on the thoughts related to food, sleep, or sex for a week, then the average time for male was 19, and for female the average was 10 times per day. And this they also reported that they thought about it based on the overall needs and not out of the blue. The second one is most believed thought that masturbation is harmful to health. The patient may come with this thought in your clinic. And regarding the masturbation, it is to achieve self satisfaction by stimulating the genitals using hands or any other object and achieving the orgasm. It's a natural process, normal, harmless sexual activity. There is nothing to be ashamed of or afraid of. It is not a harmful activity in itself, but the guilt and shame associated with it, believing it to be harmful, can be harmful. What happens is, the myth is that masturbation is harmful to health, and a person came across the discussion that with others that uh, or very first time he came to know that masturbation is harmful to health, and he may start believing because of the most of the people are saying that, discussing that, and believing that. How this myth develops that masturbation is harmful. So it's a normal process. Any other type of sexual activity is neither uh, highly discussed or condemned, or it is no, or nor it is more practiced apart from the masturbation. It is the most discussed issue among the youngsters, and according to the research, almost all men and three-fourths of women masturbate at some point of their lifetime. And if it will be true, then it would affect almost all men, which is not true. So if would be harmful to having this activity, this means your clinic will be rushed by all these males who are masturbating. So it cannot be true for obvious reasons. So another aspect is, when the onset of puberty is there, there are increased hormonal activity and development of secondary sexual characteristics, and which leads to increase in sexual curiosity, and masturbatory activities increases. And this is due to our social norms also, because of the social restrictions and non-availability of partner, and restrictions from uh, meeting with the opposite sex because of the societal boundaries. So partner is not available, the sexual tension rises, and it leads to or ends with the masturbatory practice. So this has nothing to do with the weakness or other thing which is associated with the this practice. And again, with the psychological point of view, it plays an important role in establishing gender identity, as you know, and adopting gender role in adulthood. So another fact regarding the masturbation is, it is not completely given up by the couples being married, and at some point of time they used to do this practice because of uh, maybe of because of the partner is not available, or the previous sexual session was unsatisfactory, or it is a way to relieve sexual tension if when availability of partner is not there. So it is a morally prohibited act, and it is a notion that masturbation causes physical weakness, reduce fertility, and people may also come with the notion that the bulging of veins on their extremities because of the this practice, as told by their fellows. So masturbation is not under the control of the person, it is done out of the necessity and is not being done for pleasure, then it can also be symptom of some other disease. If it is not in control, if it is a compulsion to do it and guilt is associated with it, and it is not being done for pleasure or it is done for as a obsession or compulsive act, then it cannot be a normal process, otherwise it is. Another related question, excessive masturbation reduce the penis size. This is also a common myth and misconception. So obvious for the reason, no amount of masturbation can reduce the penis length. It is the perception due to their out of their anxiety or their worrisomeness, because it has been told by the others. What happens is when you are more anxious about some aspect of your life, you see you can see some kind of abnormality when which is not there. And this also happens because some other physical reasons, that if one have to look for his genital, then he have to look downwards. And if you can think of, while you are seeing the objects from an aerial view, the things are uh, looks smaller. If you looking from a higher height, or if you are looking downwards from a flying plane, aeroplane, then you will find that the things are actually looking smaller in the size. The one other reason is obesity. While the person is obese and he is looking at his genitals, may found that it is reduced in size. So all the factors accumulates and uh, can be the person can perceive the size of his penis is smaller. But it is not true that excessive masturbation reduce the penis size. Some questions are there related to the semen. The questions are, it's a very important and precious substance, and every drop of semen is made up of 50 drops of blood. Loss of semen through masturbation causes weakness or other illness. The amount of semen in the body is limited. If you ruin it by masturbating, soon will you get over it. It will be exhausted. It will be over. So these are the thoughts are actually there. You will find as a counselor, sexologist, or psychiatrist. So what the truth is, how will you analyze the situation? If you will ask the person that it has no relation to the blood, and you can correlate the other fluids which are excreting from the body, and you can let him think that you are not bothered about it, like saliva, tears, and sweat. These are also the fluids. These may also be made up of 50 drops of blood, but you are not bothered about it because you have been told many a times that this is the fact. You have understood that fact as a that myth as a fact. So blood provides nutrition to the testicles as it does to the other body organ. You can explain. It is not certain that some amount of blood is used for production of semen. Blood is meant to provide the nutrition to the all of the body parts, not only the testicles, for converting volume of blood into the semen. Again, you can confront that the semen or ejaculatory fluid is a mixture of secretions from prostate gland, sperm, and fluid from the seminal vesicle glands, etc. So what you are seeing as a semen is mixture of different fluids and collected at one place and is ejected. Then for this reason, the part of semen is not coming from the one section. It is coming from the multiple sides. So the 50 drops of blood cannot be converted in that manner also. If it would have been, then the one only and one part will be the origin for the semen. So regarding stock of semen, they may think that they may have notion that it will exhausted and it will be get over. So you can explain that it is not limited because everything in your body is in a dynamic phase. It is not in the static. Even everything is in the dynamic phase. The physical part of all this world is dynamic, like flowing of water, so making of Himalayas, still it is on the rise. It is still in the form of making. So the other body parts like your hair grows and falls, then you have a haircut. So likewise, semen is not a limited thing. This is an ongoing process, and when it is informed adequately and because of hormonal tension, uh, you have a sexual tension. You relieve it by doing sex or masturbatory practice, or it may ejaculate during the night as a nightfall. So after this, your body starts again making the process of this semen. So it's a normal physical activity. This is man is able to achieve erection whenever he wants. So some patient will come with this problem that they are not able to achieve erection uh, very easily, not all of the time. So what they think that they are not normal. So this may have various reasons like there may be difference in hormonal peaks of the couple, while the female is on the peak and male is not, he may not get the erection. Decreased desire is lowered because of other reasons. Unsupportive partner, if partner is unsupportive during the act, then may not get the erection. For example, if you had an altercation with your partner uh, in on that day, and you are supposed to have a good or fruitful sexual activity, may not be possible. And if it is a new partner, like new partner in case of marriage also, the one can have temporary erectile dysfunction, lack of privacy at the place of intercourse, and others like excessive daily stress may be the reason for non achieving the erection. So if you ask them when you had a good erection or sexual activity, how was that day? Regarding all these factors, you can ask, then you will find that at that day, it was overall a good day, no stress or no tension or little tension was there, and partner was also in cheerful mood, so they did have good sexual activity. If it is not on the multiple occasion and if it is not continuous, then it cannot be considered as a disorder. And if the person is having frequent regarding this, then one can take for management. Sometimes what happens is they may come with the complaint of losing the erection during the sexual activity. It reduces or ends for a while, and in such a situation, the partner's role is important. Why it happens is your sexual tension is related to the sexual tension in the mind. and in the mind your sexual excitement may not remain at the same level for whole of the session. Then if the sexual tension in your mind is reduces at a point of time, then erection will also get loose. So it happens normally in such a situation. The partner's role is important to regain the erection. The partner should help him in various ways, or the man can achieve this again by stimulating himself manually or changing the position. And it is normal for erection to drop intermittently during the sexual intercourse. One should not be alarmed by this. Intercourse lasts a longer time. Some patient come with the problem of prematurity. So ideal sex should last as long as one wants to it to end. Contemporary to popular belief that sex should last hours, many couples enjoy and are satisfied with intercourse that lasts between 3 to 13 minutes, according to this study. Some females find long session pleasurable, while men may find it boring, and often partner prefer it to end quickly. Others enjoy slow. It all depends on when, where, why, and how you have sex. So for the timing, there is no rule. This is the individual satisfaction. Uh, one may be satisfied with the shorter period of time, one may be for long. And from where this myth or misconception comes, uh, when some fellow exaggerated their experience to the patient may think that the duration of mine is low. While that fellow person may not have that much of uh, longer session of the sexual activity, he may be exaggerating his own shortcomings. You know. So some says that half hour and 45 minutes and 1 hour, and which is not true. A whole session can be of half an hour, but penetrative sexual activity cannot sustain for that longer period of time. So you have to counsel and you have to psychoeducate about this timing. For the same question, there is a condition premature ejaculation. In Hindi, it is known as Shighra Patan. And so regarding this complaint of timing, patient describes it in different ways. And if you ask what does it mean, the patient come with Shighra Patan because he has heard that word, he has seen that word written on the walls, on the streets, on the hoardings, on the advertisement, and he himself does not know the meaning, but he find himself as having some problem or disorder. If you will ask what is it, he may not be able to define his problem also. Some correlates it with the orgasm of female, and some come with the problem as soon as the penis enters, and some associate it with their own time, like 3 minutes, 10 minutes, half an hour. They don't have an idea of the bidirectional aspect of the psychosexuality, but they have their own wishes for the timings. So in this connection, uh, what we can say is people view the sex as a mechanical act. That is, they fail to see the sex is a bidirectional process in which mental harmony is required between the couple. It should be slow and balanced onset of sex, and expectations from sexual act. Many other things are also important. But they see this activity only in the relation to themselves only. And it is obvious that naturally all the pleasurable factor will not be present together, so it is an illusion to think that sex will be 100% pleasurable. So for the pleasurable session, all the factors should come together, and it may not happen that all the factors are present at the same time. For example, hormonal peaks of both the partners may mismatch. The day they had uh, from the morning, the person may have stress of losing, for example, losing money, had altercation with his colleague, or there may be a family discord which had ongoing or exaggerated on that day. Though these factors are also important in having a fruitful sexual activity. So for this premature ejaculation, if it is very severe, then sensate focus method can help. This method we will learn in uh, the management part, the non-pharmacological management of psychosexual issues. We have another lecture for this. So it is a universal truth that both will not achieve orgasm together most of the time, uh, but its percentage can be increased by practice in this sensate focus method. Good sex always ends in orgasm. So sexual activity without orgasm is not considered good sex by many couples, and this is just another sexual myth. And perfect sex does not require you to have orgasm every time, and it's a biological peak of sex. It's an part of the whole activity. It is the end of that activity and relieving of the tension, and it symbolizes the complete completion of the sexual act. On another instance or other instance, many people view sex as a journey, enjoying the activities and sight along the way to their destination, rather than focusing on the end part of it. So you can compare this with when you go for a vacation or summer vacation at a destination. You enjoy the journey also. You enjoy the your preparations also. You enjoy while you are going through the pathway or you on your way. You enjoy that thing also rather than enjoying the end point. That is also important, but not always. This thing we will learn in sensate focus uh, as for the premature ejaculation. So this is another sub question of this part. Do all females achieve orgasm during the intercourse? This is not true, as some women experience anorgasmia. You must have gone through the previous lecture of sexual cycle, anorgasmia. And this does not mean that they cannot enjoy sex. There is an end to orgasmic journey, but reaching the point may be more pleasurable sexual journey. Another related question, a female can achieve orgasm only through penetrative sex. For the fact, most females need clitoral stimulation to experience orgasm, and because it is analogous to the glands of the female and most erogenous body part. It also depends on the position in which the woman has sex. Some women achieve this by having sex in certain position, which possibly stimulates both the clitoris and other external genitalia, resulting in orgasm. In this way, the chances of orgasms during sex can be increased by clitoral stimulation. More women do not achieve orgasm through the penetrative sex alone, but it is possible for some. So it is not always, because of penetrative sex does not most of the time does not have contact with the clitoris, and it may be achieved both the stimulation in certain positions. So it is not true that the women achieve orgasm only through penetrative sex. Other means can also lead them to end of the session. So it is difficult or not easy to determine who can have orgasm from having sex in particular type. It depends on every individual that how or what technique or what position leads to this end of the session. And humans can achieve orgasm in all kind of ways. Author of book Bonk, Mary Roach, found one woman who orgasmed just thinking about herself and another who orgasmed while brushing her teeth. And this happens in after childbirth also. Sometimes some female feel orgasmic activity while breastfeeding. Again, we are discussing this G spot. It's a center for orgasm, considered as a spot of controversy. Some school of thought says that it exists, but some says that it is not. Uh, but one can have idea that the anterior part of the anterior one third part of the vagina is having more neuronal innervation. So this spot is not a spot, but anterior part of vagina, anterior one third part of vagina, which is responsible for having climax or orgasm, and it is said as a G spot. So in again the most sensitive part is the clitoris, and uh, gives the immense sexual pleasure to the females. Sexual dysfunction is a medical problem only in men, because all the advertisement, all the hoardings, all the things you have seen uh, in the society, that it is targeting the males only. They do not discuss about the female problems. And if a female has a problem, then she also not come up with easily with the their problem to be discussed or to be treated. So they have sexual problems also, like anorgasmia, vaginismus, dyspareunia, and others. Or they may also have problem of anxiety, severe anxiety to having sexual activity. Size. So we had discussed about the G spot and the erogenous part, anterior one third of vagina and clitoris, and related to this, this is the male aspect. Does size matters? And even more educated society believes that penis size contributes significantly. Uh, but the fact is that the erogenous part or more sensitive part, it is not very inside the vaginal canal, and the interior of vaginal canal is less innervated by the neurons, and the anterior one third and outer part of female genitalia, the clitoris, the vulva, the labia majora, labia minora are more sensitive. So there is no point that longer penis will certainly will give the pleasure to the partner, but it may be wish of his partner that she likes it or not, like other features, like skin color of her partner, like hairs of her partner, like attitude of her partner, like any other aspect of her partner. This may be the wish of hers that uh, the size may be of this length. Another aspect is, for sizes, it is not the forceful penetration of the penis that women prefers, but truly soft, rhythmic, soothing, and gentle handling she requires. And this is the notion that this is the misconception that if they will do aggressive or violent activity, then the female will be gratified. This is not true, and this should be understood by the person who is having this kind of notions. So promotional medicines are there in the newspaper and all the advertisements, but it is not true that any of the tonic or drug can increase the size or have any effect on the size. So as so again here the same thing is discussed. The inner part of vagina is less or slightly innervated, but outer part is more. And in the last, various researches have consistently found that sexual satisfaction is more influenced by the psychological connection between both, not the shape and size of the genitalia. Intimacy and relationship satisfaction, intimacy and relationship, and which satisfy more rather than the shape and size of the external genitalia. When the it is more important when and how two people connected with each other through sex. Do women also ejaculate like men during orgasm? Some person may think that female also have a counterpart like ejaculatory function during the orgasm. This is not ejaculation, rather this is a rhythmic contraction of muscles around the external genitalia, and sometimes more excitement the females may squirt, which is not semen, but it is just leakage of from the urinary bladder, and it is not the ejaculatory fluid. Here are few sets of questions which are obvious and needs no discussion. Can a woman become pregnant during menstruation? Obviously yes. Can a woman become pregnant only by having sex in lower position? It is also a myth. As we know that uh, the meeting of ovum and sperm is required to get pregnant, whatever the position is not considered for this to become pregnant or to impregnate. Can pregnancy occur through oral sex? Obviously not. Can an adult woman get pregnant just by having sex for the first time? Yes, can have. Any frequency of sex may lead to pregnancy. The patients may come up with this problem also. They have lots many questions. I have taken only the common questions they used to ask in the clinics. Does the withdrawal method work to prevent pregnancy? Withdrawal method is uh, while this is about to climax, then the male ejaculates outside the vagina. This is called as withdrawal method. And controversy is there. Some studies say that the pre-cum contains sperm, which is enough for to make pregnant, and out of the million sperm, even just one sperm is enough to get pregnant. And the study says that this method does not work uh, all of the time. And as for the other contraceptives, they have the failure rate too. Even barrier methods have failure rate too, like oral contraceptives have failure rate, and similarly this activity also have failure rate, um, but may found somewhat helpful in certain situations. So be aware that it is not a 100% safe method. Signs of virginity. So nowadays we all know that uh, the membrane may be two legs may not rupture at the time of first sexual activity, or it may be already ruptured through exercise or masturbation in the past. Therefore, it is not a sure short sign for virginity to women to bleed during the first sexual intercourse. and ultimately there is no test to prove virginity. And regarding this aspect, there is you may know that two-finger test must have heard in the forensic science also. The two-finger test is a test for virginity or habitual sex offender. And recently in 2022, in a landmark decision by Honorable Supreme Court, and they decided to impose a ban on the two-finger test. And the apex court also warned that anyone performing this test will be held guilty for misconduct. And they considered and they said in their observation that it has no scientific basis, and it instead re-victimizes the victim and re-traumatizes the victim by doing this test, and it has no valid scientific basis, so it has been dropped from the constitution. This is the related aspect of virginity for the legal means. The last sets of questions: during menstruation, a woman become impure and the bad blood is flushed out the menstrual flow. This notion is already or are nowadays also very prevalent, you know, in very religious institutes, religious places. You know. Even in the families, the females are not allowed to enter in the kitchen nowadays also, and not allowed to enter in the temples and other places. Is menopause or cessation of the menstruation the end of women's sex life? Is not true. After menopause, many females are desirous and sexually active, and for assistance, lots of treatment available for them to have vaginal lubrication, like hormonal therapy, and other therapies are also available to continue their sexual life. Vasectomy causes impotence. It has no point to say that it causes impotence. The last question is: can having sex with a virgin woman cure bacterial disease, infectious disease like STDs? This is you will find this is very funny, but it's a very dangerous notion. You know, you are not going to be cured. Rather, you will transfer your infection to the other only. You know, this thing also found in the society. Some person may think like that. You know. And this is more in the connection of HIV. If you have HIV, then this activity can cure you, but it is absolutely not true, and it's a dangerous thinking. So, to end with the session, this lecture, there are a lot many misconceptions in the society. Misconception arises from discussion with various non-expert person, from colleagues, from self-learning, from various material available on the internet, magazines, uh, which may mislead the person to believe the misconception as a fact. Okay. So these points you may discuss with your patient in such a manner that you can bust the myths that this is not true and the actual situation is this. Uh, So thanks all of you.